Hello and welcome back to Time with Lydia, the pharmacist. Today I'm going to be talking about how to treat genital herpes. Whether you have genital herpes or not, this video is worth watching because we are going to update our knowledge on what genital herpes is, and then we'll move on to the treatment. So first of all, let's talk about the basics. What is genital herpes? Genital herpes is a common sexually transmitted infection that is caused by the herpes simplex virus. It can often be spread by skin-to-skin contact of the genitals or anal surfaces, or contact with sores or fluids of someone infected with the virus during sexual intercourse. Most people will not develop any symptoms, or they will develop only mild symptoms. And because of lack of symptoms, many people are not aware that they have the infection, so they transmit it to others without even knowing. When you get infected, symptoms start about 2 to 12 days after exposure, and they include pain or itching around the genitals, small bumps or blisters around the genitals, the anus, the thighs, or the mouth, painful ulcers that form when blisters rupture or ooze and bleed. Scabs will form on the ulcers, and sometimes there can be pain when you're urinating. There will be a discharge from the vagina that is not normal for you. You may also experience flu-like symptoms such as fever, headaches, bodily pains, and swollen lymph nodes around the groin area. Once you have the herpes infection, the virus stays in your body and it can lie dormant for a long time, but it can reactivate in the area that was originally infected. If the virus reactivates, the sores and blisters can reappear, and this is known as a recurrent episode of genital herpes. If you have a recurrent infection, your symptoms may include a burning or tingling sensation before blisters appear. Symptoms would also include painful red blisters, which soon burst and leave ulcers. You would also experience pain inside the vagina, the head of the penis, or the back passage. Recurrent infections usually last for a short period of time. Now let's answer the question, is genital herpes curable? And the answer is no, genital herpes is not curable, but the symptoms can be treated. The symptoms can be treated with antiviral medications that can be prescribed by your doctor. These antivirals can decrease how long the infection lasts and how severe they are, and they are very effective when they are taken within 48 hours of when the symptoms start. And note, they can't cure the infection. The common antiviral medications that are used for the treatment of genital herpes symptoms include famciclovir, acyclovir, and valaciclovir. You can also use creams that contain lidocaine or benzocaine, and these can numb the pain to reduce the discomfort. For people who get frequent outbreaks, a lower dose of one of these medications can be taken daily to reduce the number of recurrent episodes and also to reduce the symptoms that occur when there are any episodes at all. In addition to the medications that you can get prescribed from your doctor or purchase from your local community pharmacy, there are some home remedies as well that you can carry out to help reduce the pain and discomfort. And the first one that you can practice is sit in warm water without soap for 20 minutes when the symptoms are reactivated. Also wear loose-fitting clothing and visit your pharmacy for some paracetamol or ibuprofen that would help relieve the pain. And remember, always make sure you read the patient's information leaflet to make sure that these medications are suitable for you. Because of the nature of this condition and the fact that even when you have it, you might not know that you have it because of lack of symptoms in some cases, it is best to prevent it from happening in the first place. And there are a few tips that we can all learn to prevent ourselves from contracting this infection. And the first one is, if you have the infection, open up to your partner about it. That is, talk to your partner about having it. Don't have sex if you have symptoms. Always wear a condom and don't share personal items with anyone. I have a video on personal items that you should avoid sharing, so make sure you check that video out. Have one long-term sexual partner who has been tested for sexually transmitted infections and is not infected. Avoid kissing and oral sex when you or your partner has cold sores around the mouth. Avoid direct contact with your sores or blisters and another person. I hope this video is helpful. Please like this video, that is, give it a thumbs up. Share with your family and friends. And if you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of my interesting videos. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.